Hello, this is Heather Healthcare, and this is the first segment on what's wrong with healthcare in the U.S. My presentation today is to describe quality healthcare. Let's first determine what high-quality healthcare entails. High-quality care is access to care, adequate scientific knowledge, having competent healthcare providers, and having separation of financial and clinical decisions. What is meant by quality, you say? Quality is defined as the central goal of maintaining the good qualities of healthcare systems and striving to improve areas that are deficient. But how is that done? Helping healthy people stay healthy by promoting preventative methods, help cure acute illnesses by using effective treatments, and helping those with chronic illnesses to live better and longer lives. Access to care. Access is the ability of someone to obtain health care services when you are ill, when you actually need it. Access depends on health insurance, but who pays? Health care is not free, and the money has to come from somewhere. The money comes from the following sources: public, which is the government or your tax money; private insurance, usually an employer-sponsored health insurance plan; and then you have out-of-pocket, which is paid by uninsured folks and the wealthy. There are three payers. First party payer is the patient. Second party is the healthcare provider or your physician. And the third party payer are your insurance providers, such as Blue Cross Blue Shield, Cigna, or Humana. Scientific knowledge. When going in to be treated by a physician, a patient usually trusts his opinions and decisions. This should not always be the case, though. You need to make sure treatments are actually working and not just trying something that may or may not work. The best type of treatment should be used from evidence-based medical trials that have been proven to be effective and not a waste of the patient's time. And it can also probably kill you if it's not the correct treatment. You never want a doctor who relies on old wives' tales types of remedies, such as drink warm hot tea and get plenty of rest for major illnesses, because this might not be what's needed. You might need some type of other form of treatment or medication, or you might even need to be hospitalized. And you just don't want to put your health or your life in the hands of someone who relies on old wives' tales. Competent healthcare providers. Every patient wants a physician that knows what he is doing. Physicians should have had the educational background of going to a recognized and accredited medical school and passing all the requirements to be a doctor. Plus, you would like to have a physician that has the experience in treating the condition or illness you are suffering from. If by chance your condition is one where your physician is not familiar with, then he should probably go and seek advice or assistance from someone who has had experience with treating your illness, because you don't want any medical errors or anything to jeopardize your health or possibly your life. Separation of financial and clinical decisions. Every patient should be seen and treated regardless to whether or not they have the ability to pay for the treatment or procedure. Patients should be given the same choices and treatment options as others who have insurance or may be more financially able to pay for the services. It is morally wrong to discriminate in this manner. An example would be for a doctor to ask whether your insurance covers the procedure or treatment. And based on your response, he proceeds or declines to offer all of the treatment or the best treatment for your illness or condition. If this is the case, then you might need to seek other medical opinion or assistance, or go somewhere else where they will be willing to treat you equally as if you had the insurance or the means to pay for the treatments. Everyone should be offered the same treatment. How do we improve healthcare? First, we need to keep what's working in healthcare and maintain it. Make sure it continues to work. Next, we need to look at what's working in high-ranking quality facilities and make it the standard for all healthcare facilities. According to the U.S. News and World Report in 2014 and 2015 rankings, as far as hospitals with high rankings according to specialties such as cancer, we have number 1 ranked Memorial Sloan Kettering Cancer Center in New York, and number 2, University of Texas MD Anderson Cancer Center. In cardiology and heart surgery, we have number 1 ranked Cleveland Clinic in Cleveland, Ohio, and the number 2 Mayo Clinic in Rochester, Maine. For diabetes and endocrinology, we have number 1 ranked Mayo Clinic and the number 2 ranked Cleveland Clinic. As far as the top number 1 ranked hospital in Atlanta, Georgia, according to the U.S. News and World Report Health, it is Emory University Hospital with 10 nationally ranked specialties and 3 high-performing specialties. Also, another place that the Dartmouth Atlas recommends as being the highest percentage of individuals with 92.7% having access to effective health care in the U.S., the hospital in Berlin, New Hampshire. I think these places would be the first choice that I would go to for medical help because they have the highest rankings in the nation as far as healthcare services and their offerings of healthcare to patients. They would be a wise choice to go and seek treatment. Places to avoid, in my opinion, until there is significant improvements would be the VA hospitals. They have been investigated and have been on the news for offering subpar treatment to our veterans, and they have just been neglected, and the facilities have just not had the best of management and haven't been run properly, and the veterans are suffering. And I have a short video here that you can watch, and it will show how the services and how the veterans are not treated correctly and properly in Augusta, Georgia. Please watch. Conclusion. In order to provide quality health care to all, we must continue with proven healthcare methods that have been successful in the past. Healthcare deficiencies must be brought up to higher standards and be available to the masses to be of service to everyone. Finally, there needs to be an increase in access to high-quality healthcare by making sure people who need healthcare have the ability to get it when needed without delay, and also have the option of getting the best treatment available every time. And all of it should be on evidence-based medicine. Okay, let's review. Who pays for access to health care? The public, which is the government, which covers Medicaid and Medicare. Private, which is the employer-sponsored health insurance plans. And out-of-pocket, which are the uninsured or the wealthy. Next question. Should a patient be denied adequate treatment options? No. Everyone should be given the same options of treatment, regardless to the ability to pay. And last, which hospital in Atlanta is ranked number 1? Emory University Hospital. This concludes the first installment of the healthcare series, What's Wrong with Healthcare in the U.S.? This has been Heather Healthcare. Until we meet again.